Hi, everyone. Welcome to Talk to Us today. I'm Simrit.
And I'm Namita. And today on TalktousToday, we have with us a well-known gynecologist and obstetrician, Dr. Meenakshi Ahuja. We have talked to Meenakshi before as well in our She Roars segment. She is so amazing that we have invited her again for the second time, and she has so graciously agreed. Thank you so much, Meenakshi, for joining us on Talk to Us today.
My pleasure being here as always.
So the reason we've requested Meenakshi to join us today is because of all you wonderful viewers out there. Now, after a very successful episode on menopause and other sexual health related to adults, Dr. Ahuja had answered our questions and queries coming from you guys. We had many requests from our viewers who are mothers to do a special episode on adolescent and teenage female health. And that's why we decided who better than Dr. Ahuja to answer these questions.
Absolutely. And we all recognize that kids are growing up so much faster than they used to, or at least it seems to us.
Yeah,
we all were not aware of sex or sexual health while growing up. And we all would be told about our periods only when they would start. And then also hardly to be told anything other than how to keep ourselves clean. So the first obvious question that all mothers of young girls have is, what is the correct age to introduce our young girls to a gynecologist? Isn't the pediatrician enough?
So the way I would like to mention this is that unfortunately, although times have changed, probably school curriculums haven't. When I was in school, the teachers, although this was in class 6 and 7 and 8, but the teachers barely talked about our bodies, especially the reproductive organs. And while my kids were growing up, it was the same. And unfortunately, where now your kids are growing up, it's still the same. It's not something discussed in schools and seems to be pretty taboo. I don't know why. And somehow probably our Indian socio-cultural influences don't let mothers also be very open about it. So all of us think we are very cool mothers, but we are still very conscious about talking about at least sexual health with our children. And definitely the pediatrician, again, because the pediatrician has been seeing the child from the time the child is a baby and growing up, with the pediatrician, somehow it seems to be an awkward conversation to have for the mothers also with the pediatrician and for the young girls with the pediatricians. So sometimes maybe a new face is not a bad idea, because they understand that this is the face to which I can go with my problems which relate to my reproductive health. Again, probably, I wouldn't say definitely, but maybe girls find it a little more comfortable and mothers find it a little more comfortable talking to a female gynecologist rather than a male, because, there are intimate issues and you'll be surprised the sort of questions the young girls have. So, the moms may be at a loss to answer them. So probably a good time is that when you think that she's about to get a period, or, when a young girl is about 10 and says she's not got her periods and her friends in school have got them, or if she's got them very early when she's 9, when mothers think that it's, how is she going to understand all about periods? Because girls start periods as soon as 9 years now. Or they might be a 12-year-old who's not getting regular periods. Definitely time to see your gynecologist. Also, that the cervical cancer prevention vaccine, the HPV vaccine, if given between 9 and 14 years of age, requires only 2 doses rather than 3. So if for nothing else, at least if the pediatrician has not got it to your kids, probably that time to get the young girls to the gynecologist for the vaccination. And then, that's a good excuse to just open up and ask whatever things you may have in mind.
I didn't know that. That's really interesting because I have a lot of, obviously, friends who have teenage girls and nobody, or younger preteens, and they all said, 3 injections. So nobody has said, well, let's get them quicker because between 9 and 14, so you guys need to understand this. The HPV vaccine, if it's taken before 14, there's only 2 doses and that should cover. And the new thing is that even boys can get the HPV vaccine.
And I must tell you that the new vaccine is the Gardasil 9 or the 9 nonavalent vaccine, which is now available in India. And that is an 11,000 rupee vaccine. So definitely 2 doses make much more sense than 3, because actually the immune response of a 12-year-old is much better than a 16-year-old. And that's why they've seen that 2 doses are good enough.
So there was a question that came up, and maybe it's not related to sexual health, but the cost of this vaccine, which is 11,000. Is there any subsidy for people who cannot afford? Is the government doing anything to give subsidize? This is not for a majority of our viewers, but there was some question regarding some young girls who are, working, or their daughters.
So for the last 10 years, the vaccine which has been available with us is the quadrivalent vaccine, which is about 3,500. So that is definitely available even now. And actually, in Delhi, government has started vaccinating the school girls in class 6. Okay. So it's interesting to know that in Delhi and Punjab, the government has been providing the vaccine. We hope that the program becomes more robust soon. But Sikkim is the first state in India where all the girls are vaccinated.
Oh, brilliant. Great.
That's amazing.
Okay, so as a parent, other than the vaccines and get them, what should we do to take care of our daughter's reproductive health, or how do we go about it? I know it's it's a vague question, but how would we go about it other than bring them to gynecologist? How soon can we start talking to our kids about their reproductive health?
You have to understand that kids are very well aware because of internet and Netflix. And so you have to treat them almost not like kids, probably not as adolescents or closer to young adults, because the information out there is so much that probably they're already aware, but they may have a lot of misconceptions. So maybe with a 9 or a 10-year-old, just talking about what she wants to understand. See, like when children are small, when they're 4 or 3 or 4 or 5, we start talking about good touch and bad touch. So probably just getting them aware, maybe if you're changing your sanitary pad, or if there is a menstrual cup, at least don't brush those questions away.
Yeah, that's fair.
That's the most important thing. You may want to give them little less information, but don't brush them away. Otherwise, they look elsewhere for information. So whatever they ask, if there's a friend who's pregnant and they want to know how it happened, maybe there's a simpler way of putting it. But don't kind of just say, no, it's not your age to know or not. Because she wants to know. That's why she's asking you. Absolutely. And the right to information is everyone's right.
I remember telling my daughter, God send the babies to mama's tummy. But somewhere it comes from the tummy, for sure.
Yeah. But, you have to probably, you obviously don't want to talk about the actual process. But, maybe it's closer if you say mama and papa love each other and we decided that we wanted a baby, and that's how it happens. So
I would love to share
sex scenes on television much more than you have.
No. So I love to share this anecdote with almost everybody. I think Namita knows, but I'm not sure if you know. So my son was about 4 or 5, and he was and they're really smart. Kids today are smart, and they're, it depends on their intuitive nature. So I was holding him. I'm like, thank you so much for being my baby. The way moms do with little babies. And he's hugging and kissing me. I said, thank you, Babaji, for sending this little baby to me. And he looks at me, he goes, okay, so I became your baby because I was in your tummy, but how did I become Dada's baby? And I was like, oh, wow. So, the question came up at 4 or 5. And he actually thought about, okay, I was in her tummy, but then how is he involved in this? So then I said, Bache, actually, you were in Dada's tummy and you were a seed. So when me and Dada loved each other, we got married, we decided we want to have a baby. So the doctor took the seed out and put it inside. So it was really close to the truth.
Yes,
but
absolutely. More realistic, at least.
Yeah. And I said, then they put it inside me. So now whenever I say, you have to listen to me, you were inside my tummy. He goes, no. I was in Dada's tummy since he was born. Like, oh, God. I lost this right. But it's closer to the truth. So
probably sometimes when you feel you can't answer the questions, it's a good time to get the young adolescent to a gynecologist. Not that I'm trained that way to get, to answer medically, to answer those questions. It's not part of my education curriculum also. But with experience, you learn that what are the terminologies you can use, and you'll be surprised at curiosity. I've seen how times have changed. I've had a mother who's got a 10-and-a-half-year-old to me in the clinic, and the mother said that she wants to talk to you. So, because when the mother said that I can't answer the questions, she said, okay, let's go to a gynecologist so that, my doctor, and she'll answer your questions. And that girl sat so confidently in front of me. She was having her periods from 9 years old. And that's why I said that I'm also not sometimes prepared for it. That I think 10-and-a-half or 11, maybe 12 at the most. She asked me that, doc, how okay, how much okay is it that how often I can masturbate?
Are you kidding?
I was, taken aback by her honesty. I mean, that young girl sitting in front of me, and she asked when the mother kind of went like this, the way you did. So she went like this. Kathy, doc, I don't know what to do. I said, thank you for getting her to the clinic. And the first thing I told her that I'm happy that you weren't trying to, experiment on your own and all, and not discuss it if you had questions in your mind. So they're getting aware of their bodies. So, there was a time, things have changed, I think when we were young, we didn't talk about boys helping themselves out. But I think now everyone can talk about it comfortably. Why not girls? Why not girls?
Considering that, if we look at the statistics of how many adult women have never had an orgasm, and 12-year-olds asking this is like a big shocker. Yeah. Anyways, that's good to know.
So whenever you feel that, she needs a conversation, of course, if there's a medical problem, definitely you will get her across. Sure. If the cycles are not okay, or she wants, the bleeding is too much or otherwise. But it's not bad to have a conversation, because, that girl probably opened up in front of me, and she was asking her mother some other way or something. And definitely till the child is 18-year-old, I will be keeping a parent in the chamber. At 18, I will always ask the young adult whether she wants her mom in the chamber or not, and you have to kind of agree to that, her safety is your prime concern. So getting the information from the correct person is more important than you trying to kind of overhear everything she wants to say. So after 18, definitely give her the right. You get her to the doctor, but give her the right to be in the room with the doctor herself and understand whatever she doesn't feel comfortable talking to you, because all of us are going to kind of be like that and all and judge her. It's not fair.
No, it's not.
So Meenakshi, there is a myth, I grew up with the same myth that once the period starts, the girl's height will stop, the girl will not go taller. Whatever the age it starts, then it just stops there, other growth. So is it something which, is it true? Because my mother always kept me in this myth. Oh, now you will not.
I think that's why I think it's a way of mothers kind of getting dismayed that the young girls are growing up, and they attach the height to it. There are certain cultures where they celebrate girls starting getting their periods. So actually, your height, there is going to be a growth spurt at about 12 to 14. And there's going to be another growth spurt for girls later on, say about 16. So it's not that the height is going to stop growing at all. But it's a good time to start on exercises and all. So maybe, this myth started with trying to tell girls that they should be more active and doing more stretching and all, because the hormones are changing. So probably for that it's going to help them, and otherwise your height will not grow. And you know how things kind of change in our scenario, but definitely it's not that your height is bones are not going to grow after that.
So one is the period health and the sexual health. One is the body changes that happens, and that's related to hormonal changes. So facial hair. Now, hair is a big criteria, especially in our kind of cultures where these kids are Disney kids and they're exposed to a lot of American. Now, you don't, no matter what age you see, you don't see hairy girls, and you don't see and going swimming and underarm hair. And so little girls like 11 who are, developing faster than we did, I guess, or at least it seems so. So what do, like when they have to go swimming, they're feeling ashamed and the mothers are like, no, you're too young for waxing. No, you can trim this hair. You can't shave or you can't wax. And then, the facial hair, and then they get more and more cautious. So they start slouching, then the breasts are growing and they don't buy them bras. So this kind of discussion also, can you handle it? Like, I know it's more, I don't know, it's adolescent doctors, or would you be able
No,
to
there are
handle
no adolescent doctors. As gynecologists, we only handle this. So
Okay.
actually what happens is, and also because the mothers are probably more comfortable with us already.
That's right.
Maybe the pediatrician could also help in this, but because the moms are comfortable talk on this topic with us, probably that's why a gynecologist seems to be a better approach at this point of time. So definitely, if there is body hair which is disturbing the young girl, that needs to be off. There is no reason why you need to live with body hair if you're not comfortable with it. See, we understand that certain cultures and certain fads, people all over the world like to live with their body hair. Unfortunately, Indian and especially North Indian complexions being fair and the hair being dark, it kind of just stands out and the hair may be coarser. So definitely there is nothing wrong in getting the body hair removed if it is to the extent that it is sort of, I would say socially unacceptable to the girl.
Yes.
Because it's your body image. It's about you. You have to understand that a lot of body shaming, a lot of ragging and a lot of bullying and happens in schools. Schools can that way be a very nasty place to go to.
Yes.
People are ruthless. Your batchmates in school are ruthless because they've not learned the nuances of, how to probably be more polite. So being upfront and you want to show someone down or something, it stays with you and it can affect your mental health for a long time. There's definitely no harm, not that I was a hairy kid, but I remember that when I was about 13 or 14, maybe 13, I think. 13 or 14, I got vaccine done because my mom used to go to get her vaccine done and she took me alongside. So I didn't think twice about getting it done for my daughter. And the same thing when she grew up. And in fact, I suggested that rather than getting through this trouble over and over again, get laser done. Not that she was a hairy kid, but it's just more convenient. And why not?
My mom was like that too. Yeah, my
Yeah.
mom insisted I get it done. I'm like, I'm okay with it. I was always like, I'm like, I'm okay. This pains too much. She's like, nahi, karwa kar raha, it'll make better.
So, parents thinking that it shouldn't be done is wrong. And sometimes I've seen that when the girls come to us, it's actually to the extent that there is a medical problem. There might be a PCOS or increased androgens or something, where probably, the problem is that if you just get laser done, it's not going to work because there's an inherent hormonal problem. In those cases, probably, to make a diagnosis, treat it first, give medication for about 3 months so that the laser as a permanent treatment is going to work. But before that, getting waxing or hair removal done is definitely, there is no age that you have to decide that, this is the right age that she needs to get it done. For basic hygiene also, the girls are in sports and all. And like I said, you have to understand that Indian hair is coarser and darker. And we encourage our children to wear what they want to wear.
And also, this means that if there is a lot of hair, do go to your gynecologist because it could be underlying PCOS.
Yes, absolutely. Absolutely.
And yes, Meenakshi, this brings me to another question. Girls, I've seen, when they grow up, some days, maybe at some cycle, there's no pain. And, the next cycle, there's intense pain. So, what should be done about it? Should they go to the gynecologist for this, or is it just a normal thing to go on with?
Okay. So probably the first 2 years that when you start your period, say at 11 or 12 or 9 or 10, couple of years, they would be anovulatory cycles. So anovulatory cycle means that you're not ovulating at that time. The body is just getting sort of prepared. And at that time, it is possible that the cycles are absolutely painless. And after that, once they start becoming ovulatory, the chances that the pain is going to be more is quite possible. 2 years, 3 years, 4 years, 5 years, 6 years, 7 years, 8 years, 9 years, 10 years, 11 years, 12 years, 13 years, 14 years, 15 years, 16 years, 17 years, 18 years, 19 years, 20 years, 21 years, 22 years, 23 years, 24 years, 25 years, 26 years, 27 years, 28 years, 29 years, 30 years, 31 years, 32 years, 33 years, 34 years, 35 years, 36 years, 37 years, 38 years, 39 years, 40 years, 41 years, 42 years, 43 years, 44 years, 45 years, 46 years, 47 years, 48 years, 49 years, 50 years, 51 years, 52 years, 53 years, 54 years, 55 years, 56 years, 57 years, 58 years, 59 years, 60 years, 61 years, 62 years, So pain, which is there, which starts maybe a day before the period start. And once a period starts, maybe it starts disappearing. So probably the first 2 days are painful and then gets okay, is not pathological. It is a very normal dysmenorrhea. And if it's not intense, probably regular exercise, cutting down your carbs and sugary drinks and salt, which causes water retention before the periods, eating a lot of fruit. So those basic things actually work. And regular exercise will help in making the periods less painful. After that, probably, using a hot water bottle. But if it means that the child misses school because of the pain, please see a gynecologist. Taking painkillers is not harmful, but maybe it's not a bad idea to check that there's no other inherent problem which we are missing. So you can take painkillers for this sort of dysmenorrhea every month. There's no problem if you really need it, but take it under supervision of a doctor so that nothing is missed. At the same time, if the pain starts increasing once you get your periods, or the pelvic pain is there in the middle of the cycle, especially for 15, 16-year-olds, because by that time, if there's dysmenorrhea, it should be the natural spasmodic dysmenorrhea and not this congestive dysmenorrhea. This is abnormal. Do keep in mind that there's something known as endometriosis, which is one of the commonest reasons for severe pelvic pain. And the diagnosis of endometriosis, which later can even cause infertility if nothing else, is delayed by about 7 years. So if that is happening, that the pain increases as the cycle goes on, definitely see to it that you're seeing it or persists beyond the period. You must see a gynecologist. So it's very simple. If lifestyle changes, exercise, diet, lets your pain be okay, or a hot water bottle, and lets you continue your normal activities, it's all right. But if it doesn't let you go to school or miss a day of work, you should be seeing a doctor, friend.
Well, thank you so much for this great information, Meenakshi. I'm sure all our viewers will be very satisfied. And for any more information, we are giving contact details of Meenakshi in our description box. Please contact her. And please do make an appointment and go visit her with your daughters.
Yes. Thank you so much, Meenakshi. As always, it's such a pleasure having you on the show. I think as the questions pop up, we hopefully, based on your schedule, will see you again because the viewers keep sending these questions. So it's always nice to have you on board. Thank you so much.
Thank you so much for having me. And I think it's wonderful that you take this initiative because it actually empowers young women and young girls and older women. So I think it's a fabulous initiative and I'm really happy to be part of it.
Thank you. Thank you. That's all on Talk to Us today, but we look forward to hearing from you all. So please tell us what you thought about today's episode by sending us an email at hello@talktoustoday.com or use the comment section below and let your friends know where to find us. Also, if you're looking for one of the best gynecologists, sorry, I'm really biased, do contact Dr. Meenakshi Ahuja.
Yeah,
and
I would.
Yeah, both of us are like big fans because she's so candid. She always gives you lots of time. And I think she gives a lot of comfort. So I've mentioned this before. This is not biased. This is purely based. This is biased, I guess, because it's purely based on our personal interactions with her as a patient doctor. So please check out the description below, as Namita said, and we'll give all her information. And just for reference, Namita is out again, and that's why she's reporting over there.
Yeah, there's a lot of background noise of the wind here, so I'm keep muting myself and unmuting myself. So yeah, it's wonderful to always take these nice breaks. So yeah, I think I take too many breaks, Simrit.
I mentioned that.
Yeah. And please don't forget to hit the subscribe button and hit the bell icon to stay notified of our new videos every Friday at 6 p.m. Thanks for joining us on Talk to Us today. Remember to talk about Talk to Us today. Keep smiling.
Keep shining.
Keep laughing.
Keep talking. And most of all, stay healthy.
Yeah.
Go to your doctor. Stay healthy. Thank you, Meenakshi. Thank you so much. Thank you, everybody, for joining us.
Thank
See you
you.
next Friday.
See you. Bye.